Ladies and gentlemen, angry Americans around the country and around the globe, we have a very important returning champion joining us here on Angry Americans. One of the bravest guests we've ever had on this show. And it's really come full circle. We talked to him in April at the beginning of the pandemic, and here we are 8 months later. He's still at it. He's a friend of mine. He's an incredibly inspiring, important American who's on the front line of everything we're facing as a country right now. And he's joining us in the middle of a shift, essentially. The great and powerful Dr. Paul Hazer is back on Angry Americans. How are you, my friend?
Thank you, Paul. I'm glad to see your face. I miss seeing it in person. I'm doing well. The family's well. I know you always ask how people are, and we're sort of hunkered down, dealing with the issues of school, no school, part-time school. I think the New York City school system's gotten things down a little better. So now that we have these apps that seem to really help us as well, although about 8 different sign-ins with different passwords, etc. Feels like it's our own school. At the hospital where I'm at right now, at Brookdale, it feels a little bit like we're seeing the back end of a hurricane. You had the eye where things really did calm down a lot, and then now we're starting to see it ramp up, and it's frustrating and a bit scary, and but we also kind of know what we're in for. And I think we're also all feeling really badly or empathy for all of the healthcare workers that are on the ongoing, we've talked about it, this is like kind of a war. It's really now they're in the battle, they're in the heat of the battle. And there's this sense of compatriotism, and also feeling like, the dread, almost like a PTSD of, here we go again.
So let's start with where you are physically. Can you tell us where you are right now, and for folks who maybe didn't hear the first episode with you, where you are and what you do?
So I'm in my office now in Brooklyn at East New York, Brookdale Hospital, part of the One Brooklyn Health system that's being set up. And right now I'm in the hospital itself in my office. So, I'm a vascular surgeon. So this is, my area of expertise is not coronavirus and viruses at all, really. But it turns out that, and something that we didn't see actually even in April as much, is that COVID-19 actually has a tremendous problem with blood clotting. And so we became very involved initially, just helping our nephrologists, our kidney specialists with lines so they could put people on dialysis temporarily, to where we had a lot of patients who came in with blood clots in places that they would never have expected, and really out of the blue. And it became almost a diagnostic sign that they had, even if the tests were negative, we'd say sometimes they had kind of burned through their COVID viral titers in the nose that they would swab, but they had all the symptoms of a sort of this clotting problem that was occurring and is occurring. So that's where I'm at right now, and happy to fill you in on more details.
Folks who are listening can't see where you are. If you're listening, I encourage you to go to angryamericans.us. You can watch the video of this conversation. But, we always talk about the background, everything that is around you physically. You've got pictures of your family. You've got a Rite Aid bag, which shows me that you've been basically living in your office. But I asked you before, there's a thing behind you that almost looks like a karate mat. Can you tell everyone, what is that?
Yeah, I actually I didn't steal it, because I'm still, it's here and I'm working on it, but I took it off of one of the stretchers from the emergency room, and I use it for some of the late nights. I just lay it down in my office, just so I can crash basically there. There's been several times when I've had to come in the middle of the night or stay very, very late, that I've wound up actually staying over. So I kind of just set that up. It's supposed to look like a little door, like you don't even realize it's there. So
But
my wife tells me I'm much too, I shouldn't be lying on the floor, as an attending surgeon. But we had also what happened after the first wave with COVID really started to fall off and people started going outside was that we had over a 200% increase in our trauma,
mm,
associated probably in part with the whole movement with the Black Lives Matters and the defund the police, etc., that had gone on, and a lot more violence. And so we wound up with a lot more vascular trauma as well. So it's been a busy summer for sure.
so you're literally gonna at the point of attack on the two storm we've talked about on my show, the two storms that are hitting this move for racial justice and civil unrest and COVID, and they're both intersecting at your hospital, right? Which
Yeah.
is a place that deals with trauma on a regular basis when there's not a pandemic happening, right? You get gunshots and stabbings and violent crimes and things like that, right? So you're
Yes.
in a kind of a combat zone all the time. It feels
Yeah.
like a combat. You got your bed there. I can remember those days of sleeping in the office when I was in the Army. But that cuts to, I think, the sacrifices that you and your colleagues have been making for 9 months, man. 9 months went by like that, right? We were talking with you in the beginning, and Brooklyn was like Pearl Harbor. You were the first wave to get hit. Now you're like occupied France, right? Everything is behind enemy lines. The virus is everywhere. And it's been 9 months. Paul, what is this like for your people? For the people you've been working on, grinding this out for 9 months when everybody was at Memorial Day and Thanksgiving dinners or whatever they were doing, and a lot of folks were hunkered down and doing the right things. But what has it been like for you guys?
It comes in waves. There's times when people just, you'll hear a secretary go, I can't take it any longer. This is just making me insane. And then they kind of look back and they go, well, look, we have Zoom, we can FaceTime with people, we can, we have our family. But we've had some losses within our own clinic. Right around the corner, the chair of the Department of Dentistry and Oromaxillofacial Trauma, who is a terrific guy, 2 weeks ago got sick with COVID, and 5 days later he died. My secretary that I was, in love with, I have her. Your listeners can't hear it, but I can describe. I have this cat cup. She was working from home, and then when she came back in, I don't know that she had COVID or not, but she came back in, and 2 weeks later she died at home. So we've had a lot of losses here as well, and it really strikes you then, and it makes you afraid. It makes you realize, like, I'm gonna, I got my masks, my N95 and my surgical mask that I wear. I always double up, and we take constant care of it. So it's sort of like maintaining vigilance. I guess we're like the people on the watch in the middle of the night. We know we can't let our guard down, or the consequences can be severe. And God forbid we can give it to someone else or something like that, even if we aren't going to be affected by it directly. So I think everybody we feel in some ways now like it's shifted. Now it's sort of like, okay, we're in for the long run. And I know I was reading the CDC director was talking about December, November, February going to be very tough for this country, because even with the vaccine on the horizon, it's not there yet, so we're waiting for reinforcements in a way. I've never been in battle, thankfully. And I know you've mentioned before that you can't know what it's like unless you're actually in it. And maybe in some ways, the comparison isn't quite the same, but I do feel like we're in the, waiting for the reinforcements, and we know they're coming, but are they going to get here in time, kind of thing.
Thank you for sharing so much. I know that sharing these kinds of things is hard too, and you've been very brave about doing that. And I'm grateful for you to tell the stories of your colleagues and these folks that are in the trenches with you. Yeah, I mean, I used to say that there were two things you could never understand unless you experienced them: combat and parenthood. And now I put the pandemic in there too. Like, we're going to talk to people and say, you didn't know what it was like unless you lived in the pandemic, but you're in it. And I wanted to ask you, Paul, to share. You were texting me as we were setting this up. I said, hey, can you do this? Do you have the time? And you said, yeah, it's good timing because we're experiencing losses. You talked to me about like your wound clinic and some of the other, can you put numbers against this to show how hard
Yeah.
hit you guys are?
Yeah. So we for instance have been setting up a limb salvage, limb preservation, diabetic foot clinic, and we had one of our meetings set up, and everybody in the clinic that worked there has COVID. So the secretaries, the nurses, the advanced practice nurse practitioner, etc. So that's 4 people, but it affects 20 some people that were going to come in, and it's going to be at least 2 weeks. I mean, we're praying that they don't that they were diagnosed early, that they're getting treatment, that they're keeping an eye on them, and we've seen, I think on Monday we had about 21 patients in the hospital. A couple days ago, 34, with the 34 that were, they call persons under investigation. Of those, the majority of them are turning positive. So I won't doubt by next week we'll have 80 patients in the hospital. We have an internist who's in the intensive care unit here. So, it does strike home, and makes you realize, wow, this is, you do feel a little bit like, oh, I'm sitting in line in the trenches somewhere, and my partner just got taken out, and again, that may be too dramatic a comparison, but
No,
it
I don't think
certainly, it makes you realize that. And I give kudos to my wife and the family, because they're very understanding and supportive. She sends me very healthy foods. We're eating extra pomegranate
so.
and green tea and things like that as well. But yeah.
Your wife is awesome, and we miss you guys. You know that. And what is it? We talked about this before. For the families, it is like being a military family. It's like you're deployed to the front lines, and it's hard on them too. What is it like to be in a hospital where people are sick all around you, and then how do you go home? I mean, can you go home? Do you shower in the hall? What do you do to not bring this home? And how do you negotiate that now? And you've been doing it for months, but what is that part of it like for you and so many others? Because I don't think folks really appreciate how hard that part of it is.
In some ways it's become a routine, but and the hard part is almost making sure you don't get complacent, that you don't think, this time I don't need to worry, because that's in the back of my mind. I think always, like, one of the physicians had compared this to glitter, that the makeup you can never get off.
Wow.
And that I think for me and for all of my colleagues, we really have to reinforce that it's very important to keep to the routine. So in some ways it's become easy because it's the same thing every day. It's like putting on a uniform and taking it off. And so for me, I still change out of the scrubs that I'm wearing at the hospital into a fresh set of scrubs. Even still, when I get home, I everybody knows, which is good. The family, even the dog. Yeah, we got a COVID dog too. A little cute little Australian mini dog. And even she knows now that I'm in charge, and she doesn't come over. I go into the side bathroom, and I basically do a standing in shower, and then change into some fresh clothes, so that there's sort of an additional layer. And I just do that every day, every time I come home, and every time I leave, I'm putting back those scrubs. I get to the hospital, I change those into the work scrubs. So it's been a routine like that.
The glitter thing is so powerful. I had actually separately was explaining to Ryder, my son, this week, what a glitter bomb was. And if you think of COVID as kind of like a glitter bomb, right? I mean, it's everywhere and you can't get it off you. It's a really powerful way of thinking about it that I think is probably going to be one of the things about this conversation that people are left with, that'll resonate with them and how they think about it. But let me ask you, Paul, when we were talking in the spring, you guys didn't have PPE. You were fighting to get recognition and support. You were like, soldiers in combat without ammunition and body armor. It's 9 months later. If, President-elect Joe Biden calls you up and says, what do you guys need? Or the American public says, you get 30 seconds on TV. What do you need? Paul, what do you need?
I think we are going to need more PPE. We are still scraping along. We found ways to sort of reuse a lot of our PPE and to have it sterilized kind of put it on a rotation, etc. But I do think ourselves and a lot of our hospitals are going to need that. You know, I think one of the main things we really need that we have discussed a lot, we have high trauma, as we talked about. We also have an incredibly wonderful interventional cardiology group that has one of the best rates of cardiac recovery after heart attack. And our chairman was asking, how can we save these people that have, you know, been shot right across through the heart, right above the heart, or, you know, they come in with major MIs, myocardial infarction, heart attacks, and we have such a good rate. And I was explaining, you know, as we looked at that, that there's between 14 and 21 people per patient that take care of those patients. And with COVID, people come in and there's maybe 20 patients and one person to take care of them. So we need a lot better coordination to recognize, almost like calling it code COVID, that these people come in. And I do think the patients, and the reason the mortality rate's gone down a lot, and thankfully at our institution as well, is because we understand things a lot better. We can get into that later, but I think that we need a better coordination. We need someone to recognize, for instance, when the military ship, I can't remember, the Mercy or the Hope came up, the Hudson, everybody was so excited. We didn't have a phone number to call to send our patients there. The time we sent our patient, we had to send 5 days worth of supplies, and we were coordinating that ourselves. And that's down to the, you know, pillowcases. So that kind of thing needs to be readjusted, and sort of a playbook, I think, set up so that you can say, oh, here's the number to call, you know, the Staples button, you know, hit the red button and boom, patient gets transferred, that kind of thing. That's what I'm hoping for.
That's clarity we need to hear. And it's shocking and outrageous. And, you know, if there's a reason to be angry that is justified, is that you guys still don't have PPE. And there's the old military saying that amateurs focus on strategy, experts focus on logistics. A lot of what you're talking about is logistics, right? And coordination at the national level all the way down through, which we've never had. And I think people will still be surprised to hear that in a frontline hospital in New York City, you still are in that position, which is infuriating, but helpful to get that clarity from you. But let me ask you what you kind of touched on. What have you learned? It's 9 months later. You've learned a lot about the virus. You're saving more lives. People have a higher, looks like, survival rate. You all are obviously now grizzled veterans of this fight. But what have you learned about how to tackle it? And maybe what have you learned about yourself and leadership throughout this?
Well, you know, from pragmatic things such as putting people on blood thinners quicker, and trusting our clinical intuition towards a diagnosis rather than actually having the test positive or negative. I think, you know, I started to read the New England Journal of Medicine, which I hadn't read for a long time other than specialty articles for vascular. And I realized that I've also learned that there's a lot more to know about this than I know. And that there are a lot of people smarter than me who really have studied this. As I said, you know, I'm a vascular surgeon, so it's not necessarily an area that I'm directly involved with, but we've learned about, I think what you said, I think logistics play a huge role in saving lives. You know, we lost patients before because they would disconnect from their oxygen to get up to use the bathroom. They wouldn't call a nurse, or, you know, there wasn't enough nurses to watch out. So we know now to keep a closer watch on those patients. And we also know to really avoid intubating patients, because that seems to be, in some cases we have to, but we've definitely stretched the limit in terms of that and looked again more at clinical things rather than the numbers, because this virus behaves differently than some of the other SARS viruses had in the past, the MERS, et cetera. And in terms of leadership, you know, I think all of my colleagues have sort of taken up the helm in recognizing both personally to take care of the patients, but also in terms of trying to get information up the chain to Albany, to Washington, D.C. I am kind of excited about President-elect Biden, and hoping some maybe you can connect with Mayor Pete Buttigieg, who I know you had on the show and I met. thankfully back in the days of the real in live person filming and taping, that getting someone in logistics and setting up a playbook can make a huge difference for everybody.
You got it. I'll send notes to anybody who will listen, and I think that a lot of folks are listening now to you and looking to you and others to cut through the bullshit, and especially when there's such a conflict coming out of the White House and what you're experiencing on the ground. It's sobering, but it's also inspiring. What are your thoughts on the vaccine? You know, we're hearing it could hit places in the next few weeks. Going to frontline health workers. I assume that means people like you, and also into nursing homes. You know, what are your thoughts on the virus as someone who's likely to be at the front of the line, rightfully so, to get it?
So, you know, it's interesting because I think one of the things that isn't being talked about with the vaccine is actually testing people for antibodies to see whether or not they already have developed antibodies. It turns out I actually have antibodies to corona. And I don't know the titer, but I don't know, therefore, that I'll need to get a vaccine, or certainly I might not be the first in line for it. I think the study's been very good for it's been incredible, actually. And, you know, you can give kudos to even President Trump for the warp speed, and Vice President Pence for helping, basically paying the companies to really push this through. And I do think, and I do listen to Dr. Fauci fairly regularly. I think that I trust what he's saying, and also the example he's setting, which the other two hadn't been, about the vaccine and about what its options are. And I think I'll digress just for 1 second to say, you know, it was almost in some ways unfortunate that President Trump got COVID when he did, because he gave this impression that it's not that serious, that, oh, you can get over it. You know, I don't know how much money was spent on the president, and I'm not saying don't spend it, but for 4 different physicians, you know, hospitalized, you know, the very latest, very expensive medications, and very strong medications, and then to give people the impression that, oh, I'm immune, I don't need to wear a mask, even though we don't even know if, even with immunity, you can't spread it. You probably could. You could pass that glitter along, even if it's not going into your own body. So, so I do think that I'm very hopeful, honestly, for the vaccine. I'm a little concerned about the fact that we don't know what the long-term, you know, 2-year, 4-year data is going to be in terms of, could it affect white cells? Could it affect the red cells, or how we process other infections and stuff? And that's just an unknown. So it is a sort of a risk-benefit thing to do. But I also think that, you know, there's 5 different companies working on this. There's some of them that have been actually working on this vaccine at a much slower pace for many years before. So in terms of that, I think that, at least for adults and for the nursing home people, I think there's some hope.
That's the question I was going to ask you also, Paul, is what gives you hope? And I think, you know, you're seeing some of the deepest pain. You see that even when there's not a pandemic. But can you talk about your colleagues? Can you talk about the heroism that I don't think, frankly, gets enough? You see a lot of folks on TV, you know, talking about the pain and talking about how hard it is. But, you know, somebody told me once, when you go to combat, they always ask you how many people you killed. They never ask you how many people you helped. And I think, you know, they always ask you how many did you lose, but you guys are saving people every day. So can you talk about the heroes that are alongside of you, many of whom are unsung?
Yeah, you know, for instance, we had one of our nurses from the night shift who got the coronavirus early and wound up quite ill, for a long time hospitalized. And when he came home, you know, the entire hospital was cheering for him. You know, they had a whole thing, an overhead speaker and such. And I think there's been a lot of hope in terms of that the mortality rate is much lower than it was, that we do feel like we know it a little bit better. There's, in some ways, we're not quite as afraid. You know, my colleagues now, I had some that weren't even going home at all, that were not seeing their families, were sleeping in an apartment, etc. Now I think they feel like, okay, if we follow these routines to keep everybody secure, we can have a semblance of a pretty good life. And we can celebrate, like you were saying, the wins, celebrate the saves and stuff. I think that everybody that I know that I work with is very humble. They don't feel that they're big heroes. They're just doing their job. And I feel the same way too. It's just we're taking our precautions, and then we're taking care of the people that we can, and we're grateful in some ways that the patients come in to trust us in terms of that. I think earlier in the pandemic, a lot of people wouldn't even come to the hospital. They were afraid they were going to get it, or that this was going to be the time. And I think now we're really working very hard to make sure that they feel comfortable with that. And that gives us some hope as well.
How do you, a lot of the country's feeling burnt out, right? And they feel like, I'm tired of wearing a mask. I'm tired of doing this. I'm tired of homeschool. You're a guy who has more of a right to be tired than pretty much anybody, but yet you keep pushing forward. And, we on this show have been encouraging everybody to hunker down, hang in there, keep driving on. There is hope out there, right? We've got to be really diligent for what could be 4 months, 5 months, 6 months, might be 8 months, but there is a light down there now at the end of the tunnel that we can see, and we can see what the future will look like. We got to hang in and stick together, but it's still really hard. How do you deal with how hard it is, Paul?
I think vive la résistance, as you said, we're like the occupied France, in some ways. New York does feel a little bit that way. It's reopened, but not completely. There's still lots of empty restaurants, lots of empty places, and people we haven't seen. So, but as you mentioned, there is the hope of this light at the end of the tunnel. And in some part, what New York went through, and the fact that we were able to really break the curve, as Andrew Cuomo, Governor Cuomo said. That gives us hope as well, that if we do the right things, if we shut her down, stay frosty, as you said, that we are going to break this curve again. And I think we're also, hopeful. I think between the lower rate of death and the higher rate of save, let's put it the positive way, that we're saving more people. We're seeing some of our colleagues come back to work, still don't smell everything quite right in some cases, but we've had a few physicians who came back after they had were pretty sick with it, kind of along the way Chris Cuomo was, where it was really hit them hard, and now they're back. So that gives hope. And I think there's this thought that it's not going to be quite as bad as the last time, and that at least we know now, the enemy, so at least we know what to expect in a way. It's not like, oh no, what's going to happen this time, or what's going to happen that time. Now we have a little bit better options, and there's hope too. There's new medications, and the fact that all those studies that I'm reading from the New England Journal offer a lot of promise, and have debunked some of the political reports that came out about what might be helpful and what might not be.
You have been exceptionally helpful, my friend. I mean, you thank you for educating our audience. Thank you for what you're doing every day, getting up from your cot behind you and going downstairs. You're going to hang up this Zoom and go back down there now and continue to fight the fight. So you are a tremendous leader. I'm honored to have you as a friend, and grateful that you came back on this on the show as a guest. You represent the best of what your profession and this country are all about. So I just want to thank you and thank all your colleagues. And when you head back down there, tell them vive la résistance, and we've got their back. But we're really grateful for you, man, especially taking time out of the fight to join us.
Thank you so much. Thanks for having me, Paul. It's always great to see you. And again, I don't know that I deserve half of what you're saying, but you really do help inspire. And even like the comparison that you gave, that we were talking about before with we're in the resistance now, the occupied France, it kind of helps frame things a little bit for us, and it does give us hope as well. So thank you.
I realized you told me I owe you some whiskey, so you didn't get the Uncle Nearest. That's coming your way, okay? And I'm going to find out what happened to your Bravo Sierra gear. And we've actually got a new supporter of the show that I love, and I'm going to send you some. Tommy John. It makes incredible clothes for men and women, and they've got these incredibly comfortable men's lounge joggers. They're like the most comfortable pants. I don't know if you can wear them under your scrubs, but maybe you can. I'm going to get those to you. Shout out to Tommy John, but you're going to be our first guest to get a pair of these. And you can rock them underneath your scrubs or on your cot or wherever you go, man.
Thank you so much, Paul. I really
Thanks
appreciate
for all
it.
you do, brother. Stay vigilant and stay frosty.
All right. You as well.